Now, in the studio, Dr. Meredith Travelstead. Did I say it right, Doctor?
You did.
I did. All right, great. She's an OBGYN from the Women's Clinic. We asked the doctor to come in and chat with us a little bit about some of the vaccine hesitancy we're seeing, particularly from females who may be concerned about how this might affect their ability to become pregnant. Among a couple other topics. But anyhow, welcome to the show, and give us your thoughts and your insight on that.
Thank you. Well, thank you for having me. I always say this is a conversation we are having every day with patients from start to finish of clinic. A lot of concern, a lot of hesitancy, especially related to pregnancy. Pregnancy is like in training, they used to say pregnancy is a disease process because everything in pregnancy can get worse. Hypertension, diabetes, pregnancy-related complications just because you're pregnant, because there's a lot of pathophysiology going on during a pregnancy. So COVID is no different. The coronavirus infection is no different. So pregnancy itself has a whole list of complications such as preterm birth and maternal complications, ICU stay, ventilation, even death, that are higher risk for pregnant ladies than for non-pregnant ladies. So that has brought up the concern that the COVID vaccine should possibly be given, and is being given in pregnant ladies, even though it wasn't studied initially in these phase 3 trials for this vaccine. So that conversation we talk about every day. And then there's also the concern about fertility. And there was a lot of information on the internet about the short bite was COVID vaccine causes infertility. Yeah. Where that came from was the mRNA code that they use for the vaccine had some common genetic base sequences with a placental protein. And so there was postulation, well, if we develop antibodies to this spike protein from the vaccine, that we might develop antibodies to a placental protein and cause miscarriage or stillbirth in a baby, attacking the placenta. But they further evaluated that and didn't see many parts of that sequence that were in common. It was really only a small part, and there's been no data to suggest that that we're developing antibodies to that placental protein. So that's pretty much been dispelled.
Well, you talk about some of the complications. A personal experience with that with my wife years ago, pregnant with my son, had some circulatory problems. Is it eclampsia? Is that the right?
Preeclampsia.
Yeah. And was
eclampsia is seizures.
Oh, okay.
With that, like the worst form.
Okay. So maybe it was because she was instructed to stay in the bed for about a month in her final month. And expecting dad here had to wait on her hand and foot back, which I was glad to do. But, as soon as she delivered, it cleared up. It was kind of amazing.
It is.
But, yeah, so I get it. And so what would you say? What are you telling your patients? So I guess there's really two issues. There's someone who's pregnant. There's an expecting mother who has concerns about taking the vaccine. And then there's that want to become pregnant, that are concerned about, as you indicated, doctor, fertility. So what? And you gave a great explanation of, I guess, from a clinical perspective, what the situation may be as it relates to the vaccine. And I wasn't aware of that, of its alignment or its sort of close association, the way I interpreted it, with what happens when you, I guess, get pregnant or trying to get pregnant, maybe. So what are you telling? You're saying you're dealing with this all day. What are you telling folks? That, let's say someone who's worried about, if I take this vaccine, I might become infertile. What are your remarks and your response to that?
Well, I think, first of all, everybody, when we talk about vaccine hesitancy, I think we're all hesitant at first, right? Sure. We all have to work through the process of deciding what we're going to do with our body.
Yeah.
And some people are further along that trajectory than others. I think you see a lot of healthcare workers that put their arm out immediately and get that vaccine as quickly as possible because they've seen some of the really, really bad effects of coronavirus infections. They've seen the intubated patients. They've seen the rapid deterioration of patients before their eyes. So they might be more apt to get it quickly than, say, someone that has not been exposed and sees people get it and low risk and recover quickly. And they're saying, why would I take a vaccine we don't know about for a viral infection that's not that bad, like the flu, or not any worse than the flu? Mm-hmm. So I have to spend time, I think, talking through it with a patient. It's their decision. It's just like anything in healthcare where we talk about medicines, and we're always weighing risk and benefits. We talk about surgeries with patients, and we do a consent form, and it's an informed consent, but we don't know really what's going to happen. We don't know of some untoward outcome that can happen, and we're always weighing risk and benefits. We're always trying to decide, is this benefit that I'm going to get from a surgery or a medicine or a vaccine worth the risk of taking it, something that unknown might happen, or is the unknown of the infection itself and how severe that can be even more risky for me?
Yeah.
So it's definitely weighing risk and benefits with patients.
Are you seeing patients, women who are pregnant that have been vaccinated? Are you seeing them part of your patient community?
Absolutely. Our clinic, we have seen a lot of patients. I will say healthcare workers, nurses, doctors, physical therapists, respiratory therapists, physician assistants, nurse practitioners, they're the ones that have stepped up as medical people and gotten the vaccine quicker. Yeah. Yep. But I have seen a lot more patients getting it now. And there's actually a database now nationally of more than 30,000 people, mm-hmm. pregnant women and breastfeeding women that they've studied, and they've compared those who got the vaccine and just normal, healthy pregnant women otherwise, and they have seen no difference in pregnancy outcomes or complications, stillbirths, miscarriages from those vaccinated versus non-vaccinated. So they say, it hasn't been tested yet, but we do have 30,000 ladies that we can look at and see that there's no difference in outcome in large studies. On the flip side, we have a whole year of COVID infections in pregnancies, and those outcomes have been much worse in pregnant ladies than in non-pregnant patients.
Well, what about, have you seen any patients that are, I don't know if you would treat this as an OBGYN, but they are trying to get pregnant, unable to.
Mm-hmm.
Okay.
We do.
All right. Have you also seen any that are newly pregnant but have been vaccinated?
Yes, many.
Okay. So it doesn't, I guess the reason I asked that question, I think is fairly obvious, is it would seem like if the vaccine, in fact, would prohibit someone, a female, from becoming pregnant, you maybe would have seen some of that.
And I think that's common sense approach. And I think patients, when we talk about what I said about the placental protein and all, and when you look at, we have a database, this vaccine is making us respond to a spike protein, part of the virus.
Yep.
We have a lot of data of a whole year's worth of COVID infections, and those patients haven't seen increased infertility. So you think if you're having the infection itself and it causes infertility, then you'd be more worried about a vaccine.
I got you. Makes sense.
But we are not seeing that.
But in general, are you advising your patients to take the vaccine, or do you get involved in that level of advice?
Sure. I feel comfortable advising them to get it. I don't force it upon patients.
Sure.
It's just like there are other vaccines in pregnancy that we give, flu vaccine, Tdap, which is pertussis, tetanus vaccine, and diphtheria, and we encourage, and those are the type viral vaccines you can take in pregnancy. There are some vaccines you don't take in pregnancy, like varicella, chickenpox vaccine. But there are these vaccines that are safe. We encourage patients to do it, but again, it's patient autonomy. They decide for sure.
We got just a couple of seconds here. What about your staff? Are you requesting or requiring your staff, or how
we
have you
haven't
handled
made
that?
it mandatory, and there are some that have decided not to, but most all of ours have gotten it. Yes.
Got it. Appreciate that. Doctor, thanks so much for joining us today, and thanks for clearing up a lot of the complexities associated with that. Appreciate you've got the expertise. We really appreciate you coming on.
Thank you. We appreciate y'all.
You got it. Dr. Meredith Travelstead, OBGYN with the Women's Clinic, has been our guest. We got a break right here. We'll come back. The JT Show continues.